Hello guys, today I'm going to talk about a very important topic, black fungus. I'm also going to talk about white fungus and yellow fungus. They are kind of epidemic here in India, especially the black fungus. What I've done is I've talked to my sister, who's also a doctor. So she told me all about this, which I'm going to share you in this video. So let's begin. Alright, so black fungus or mucormycosis. It is very serious but was previously very rare disease. It is caused by exposure to the mucor mold, which is commonly present in soil, plants, manure, and even in decaying fruits. But it's kind of present everywhere also, like in air, in small quantity, of course, in air, in like soil. It is even present in nose and mucus of healthy individual. So that's about it. Then it's most commonly affect the sinuses and lungs after inhaling that fungal spore, and it can also occur on the skin after a cut, burn, or like other type of injuries. Then the condition does not spread from person to person. It's like it's not contagious. In If an infected individual, it can't give it to another healthy individual. So it doesn't spread like that, and it doesn't affect even healthy individuals at all. You know, like we can have an exposure to this mold and remain totally unaffected by it. But who those who have like diabetes, or those who have compromised immune system due to certain diseases like HIV or cancer, they are affected by it. Like there's high probability they can be affected by it, but in healthy individuals, uh, it's very low probability that we can uh, get affected by it. So now I'm gonna discuss how this disease, that black fungus as we call it, how does it became an epidemic in India. So the reports of COVID-associated mucormycosis or black fungus have generally been rare. A review of medical literature traced only 8 cases reported around the world by 9 January 2021. So it was kind of rare then, but due to its rapidly growing number of cases, the government of Rajasthan declared it an epidemic on 19th May, and then along with the Rajasthan government, the government of Haryana, Tamil Nadu, Telangana, Gujarat, and Bihar have also now declared this as an epidemic. So, and you know, as BBC reported, it's BBC who reported it. India have nearly 9,000 cases of this rare infection as of now. So, so why did it become epidemic here in India? One explanation for why the infection has surfaced remarkably in India, it is that high rates of COVID infection and high rate of diabetes. But obviously there are more explanations than that. Excessive use of steroid in COVID treatment, while it calms the inflammation of the coronavirus, it is also that reduces immunity in a person and also raises blood sugar in those individuals. Than that, and another likely cause could be the improper use of oxygen cylinder, with unclean mask or without purified water in apparatus. And then lastly, the excessive steam could also lead to black fungus. There's a delicate mucus layer that protects us from bacteria and viruses, and there's a slimy layer, that can be destroyed by the large amount of steam, so the fungus can easily attack after that. So it was the cause. So what are the symptoms of this black fungus? uh, Look, it have different symptoms when it affect different part of the body, like for sinus and brain. It would lead to one side of facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge, or upper or inside of mouth, that well becomes quickly more severe, and then it can also lead to fever. When affect lungs, excuse me, when affect lungs, then it include fever, cough, chest pain, and shortness of breath. When it affect your skin, then it can look like blisters or ulcers, and infected area may turn black. So, what is the treatment of this black fungus? Like for now, it's just amphotericin B that we know are working for black fungus right now. Other antifungals like those are common, that fluconazole, terbinafine, itraconazole, that doesn't work on this fungus. Amphotericin B, it is usually administered for like 4 to 6 weeks after the initial therapy begin to ensure the eradication of infection. And what I mean by initial eradication, it would definitely be that area affected by fungus, like suppose that nose bridge or jaw or anything, it have to be surgically removed. You know, uh, surgery have to be done on it. Like it's you know it's just too dangerous. Um, for this start with, like it starts with excuse me, it start with mouth usually. So once it enters mouth, then it goes up to sinuses, and then eyes, and then to brain. So at any stage, whenever you want to like get treatment or stop it, you have to surgically remove the other part that's affected, mind you, and then only that amphotericin B is administered. So it have to be removed if it can be eyes, nose bridge, or jaw. That's why. And the sad news is that it have mortality rate of 50%. Like in every two individuals affected by it, one dies. So like everybody knows, prevention is better than cure. So how do we prevent it? Let's see. By firstly, you have to clean and replace the humidifiers for those who are using the oxygen concentrators. Then sterile, normal, saline should be used in humidifier bottle and changed daily. And mask should be disinfected and washed daily. That oxygen mask, it should be washed daily. And those who are taking steroids uh, should also keep changing their checking their blood sugar levels, you know and excessive steam shouldn't be taken for too long also. These are some kind of preventions that we can do. As the research is going on this subject, we will come up with more prevention than this, obviously. Now this white fungus, there's this new fungus after black fungus, this white fungus. you know it's even more lethal than black fungus. White fungus, its medical name is aspergillosis. It has started to spread, and white fungus, it is 4 times more dangerous than black fungus. It damages many part of our body and spread in the lungs. It also shows severe effects on kidney, mouth, skin, and the brain. So, and white fungus symptoms, uh, it is cough, fever, diarrhea, dark spot on the lungs, reduced oxygen levels. But the symptoms of this white fungus are similar to COVID. So it's like we won't ever be sure if it's COVID or white fungus. But what we can do is how it's diagnosed. It's diagnosed through CT scan and X-ray that can show if the fungus is there. And this just like black fungus, it also prey on immunocompromised people. So the criteria is same. It won't affect healthy individual probably, but for now it just affect only those who have low immunity. Uh, then this yellow fungus, it's just only I think very few cases in India that of yellow fungus, but it's even more lethal than white and black both. So is this a new variant or something? But a patient in Uttar Pradesh, Ghaziabad, has been diagnosed with yellow fungus. So the symptom of this yellow fungus, it's loss of appetite, lethargy, and weight loss. In the later stages of infection, patients also suffer from uh, like suffering from yellow fungus already. They exhibit severe symptoms like sunken eyes due to malnutrition, uh, organ failure, slow healing of wounds, and oozing of pus from the wounds, and necrosis, that dying of cells. And like black fungus, the treatment of yellow fungus is amphotericin B injection. So it's the same treatment, um, but it's different disease, totally different disease. So as an individual or as an Indian citizen, lastly I would like to add that while this corona is increasing, there surely, I don't want it, nobody would want it, but there surely will be more hospital borne infections, there will be more funguses, there will be more bacterial infections, because the amount of people that are getting infected by corona, and that those who are taking the steroids, it's enormous. A very big population of Indians have been immunocompromised by now due to intake of steroids. So these kind of infection, these fungal and bacterial infections, it will run rampant across the India. It's very sad, but we got to take some measures to cure it, or well, prevent it if we can. So having said that, I would like to inform you that, so having said that, um, what we can do to prevent it, there's very little we can do to prevent it. So we need prayers, and we need education to get over it. So guys, please pray, wherever you are, whoever you are. If you're watching this, please pray for my fellow Indians and even me, that we can come over this serious kind of diseases. Thank you. So, thank you for watching, guys. Salamat po.